Welcome everybody to another brief video in our Deeper Than the Headline series. I am CJ Wolf for Healthicity. And in this series, we try to just go a little deeper than what you can read easily in these headlines of compliance or coding types of settlements or enforcement actions. Now, today's headline that we want to talk about, the case is not fully finalized yet. We're kind of in the middle of it, but there's been a lot that's been shared. This case has to do with nephrology procedures and imaging procedures on patients with end-stage renal disease, people who are getting regular dialysis. And this is taking place in the state of New York, allegedly. So again, kind of our disclaimer here is that these are allegations of fraud, and they have not, and nor do they usually go to trial. Usually there's a settlement. This one we don't know yet. They're in the middle of it, so we'll see if it proves to turn into something or not. But it's interesting nonetheless, and there's some insight that we can gain just to, what can we learn from this? How can we avoid non-compliance? Even if this particular case turns out to be nothing, or it turns out to be something, we can still learn from the allegations. Now, what's interesting here is that it's two physicians who were the key TAM relators or whistleblowers, and they are both nephrologists. And what they're claiming, it's a long story, and we have only a few minutes here in this video to kind of go a little deeper into the headlines. But the allegations are, when a patient is on dialysis, one of the most important things medically is that they have access to their blood system, right? To their cardiovascular system, so that they can remove blood, send it through a dialysis machine, clean the blood, and put it back into the body. But you can't do that just drip, 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 drip. You need a certain amount of volume of blood, and you need constant good access. And you can't just be sticking, a vein here and there. And so oftentimes a surgical fistula will be created. A fistula is when, yeah, to simplify things, an artery and a vein are surgically connected. You get a larger flow of blood and a stronger access site. So because people on dialysis are often hemodialysis or getting dialysis 3, sometimes 4 times a week, and so for a long period of time, years, if not the rest of their lives. And those fistula can sometimes become, they can get clots, they could start to stenose or narrow, and you can get some issues that's going to affect dialysis. But not every patient has that. And what was alleged here is that the organization was setting up automatic imaging studies of those fistula, even if the clinical criteria did not say it was always medically necessary. So dialysis was not being the effectiveness or efficiency of dialysis was not being affected, but yet these patients were scheduled for what they call fistulograms, when you inject contrast or dye into the bloodstream and take a picture with an X-ray machine to look and see, is that fistula narrowed? Is there a clot in there? What's going on? And if there's narrowing, you might do an angioplasty, which is you kind of inflate a balloon. I'm simplifying things here for the short amount of time we have on this video. But basically, the allegation by these two nephrologists was that this organization was setting up automatically doing these diagnostic imaging studies called fistulograms, and then some sort of therapeutic procedure like an angioplasty. And what's interesting when you read into this a little bit more is they get into the details of what clinical criteria usually are necessary during dialysis. So if somebody does have some sort of blockage in the fistula, or is having some sort of access issues or potential problems, some of the clinical criteria, lab work, and those sorts of things, flow metrics, will show that there could be something wrong with the fistula while the patient is having dialysis. And maybe in those circumstances, it's appropriate then to go ahead and order these imaging studies and then therapeutic studies if the imaging study shows that there's a blockage. But because it's pretty common that these types of things happen, or at least it's not rare, sometimes people might get, and again, these are all allegations, might get overzealous and say, let's just set up patients. Let's be super efficient. Let's just set up patients to have these tests done all the time, right? So that we prevent this. Well, from a Medicare and a Medicaid standpoint, that in their argument does not meet medical necessity for doing these procedures. And so those have to be individually based decisions based off of the medical necessity, given the clinical criteria and circumstances of that given patient at a certain point in time. So what's interesting here is that the United States has intervened or joined the whistleblower lawsuit. So from a federal government standpoint, they are going to look into it. We'll provide you the link to the story, as well as at the bottom of that story, you can actually download the actual complaint that the government is filing, and they have examples of patients. I don't believe there's any patient identifying information, but they give examples of patient A and patient B, et cetera, showing what's going on and what's wrong with that. But also, just in the last few months, probably the last 6 months, the Attorney General for the state of New York has also filed a lawsuit for the Medicaid claims. And what's interesting here, and of course, there's multiple sides to these stories, and we'll see how all this plays out. But in their complaint, they give some examples, and they probably pick some extreme examples to make a splash. But they give an example of a 41-year-old end-stage renal disease patient in New York undergoing at least 27 unnecessary angioplasties from a certain time period. And then another patient in Brooklyn, an 80-year-old end-stage renal disease patient, allegedly underwent at least 15 unnecessary angioplasties during the same time period. So these are interesting. Medical necessity is always interesting because a lot can be argued on both sides. The arguments here are at least being brought forward by 2 nephrologists, individuals who have some expertise in this area, and so the clinical, why this is an interesting one to go deeper on, is they provide some of the clinical requirements that they feel must be met before you do a fistulogram and an angioplasty. Remember, fistulograms and angioplasties, though they might not be deemed super high risk, there's always risk with doing medical procedures, and it's not appropriate to put patients under the risk of medical procedures if it's not truly medically necessary. And keep in mind too that the medical necessity requirements for a payer may be different than the clinical threshold for which to do. The clinician might say, oh, I'm going to order this test. So Medicare I don't speak for them, but assuredly I believe they would say, we're not telling doctors how to practice, but we're telling you what we as a payer will and will not pay for. And so that's where these False Claims Act cases come in, and all of this is going to be very interesting to follow. And maybe we'll have a follow-up on another deeper than the headlines video. Thanks for watching this one, and look for the links to these stories.